Hi everyone, it's Dr. Steve Weiner, and I'm going to talk to you today about hyperhidrosis, which is excessive sweating. It affects millions of people in the US, and I'm going to talk about a paper that I wrote as well, and actually a new technique, so you listen up. So hyperhidrosis is affecting 4.8% of the US population. That's greater than 15 million people in the US. Axillary is the most common, that means under the arm. It's about 50%, but it also can occur on the hands, feet, face, scalp, and so forth, even on the body. So primary is a disease actually of the sweat glands, and secondary, it's from a secondary cause. So 69% of people that have hyperhidrosis have an emotional and physical impact. It affects their work and social environments in 63%. It limits their physical activity in 50%. So it's a negative impact on health, has been compared to vitiligo, chronic pruritus, and psoriasis. And they also have a higher number of skin infections. So it really is a problem in the population. What's very interesting is actually it varies from country to country, probably a genetic variation. Sweden is 5.5. Actually, Vancouver, Canada is 12.3. Shanghai is 14.5. So when you consider both primary and secondary, Germany and Vancouver and Shanghai and Sweden are very high. So it affects a lot of people, up to 20% of people in Sweden. So there's a lot of different treatments available, and I'm going to go through them briefly. I'm going to go through how we treat it here at the Aesthetic Clinic. So topical aluminum chloride is probably the most common recommended treatment. It works, but not that well for most patients. There's Qbrexza, which is glycopyrrolium pad. It's an anticholinergic, and patients report about a 32% improvement. Oral anticholinergics, glycopyrrolate, are also given, but they also have other side effects. There's other orals, oxybutynin, pilocarpine. Ionophoresis, it's a pretty long process and it's temporary. So once you've tried all these above here, now it's time to try things that work more aggressively. And injecting botulism toxin A really does work, and I'm going to show you a novel way to inject that. Microwave thermolysis, mirror dry, also works, but there's sometimes prolonged pain, 3 weeks, and there's a lot of swelling. Another type of treatment is curette or liposuction. There's also surgical, where you actually go in and do a mini thoracotomy, and you do a sympathectomy. But I'm going to talk to you about radiofrequency microneedling as a treatment. It's really good and really fast. So when you talk about hyperhidrosis and you do papers, you need to talk about the severity score. So 1 is my axilla is sweaty, but it never interferes with my daily activities. And then 4 would be my axilla is very sweaty and intolerable and really restricts my activities. And then 2 and 3 are in between. So the traditional form of treating axillary hyperhidrosis is using Botox. And it's 100 to 150 units, 50 to 75 per side. At 4 weeks, the HDSS score, which I just previously showed you, was 1 or 2 in 85% of the patients. So that's pretty good. At 12 weeks, it was 90% 1 or 2. And the results last between 6 and 9 months. Unfortunately, repeated injections are needed because it's only a temporary effect. Patients want more long-term effects. So I have a little different way to inject than the traditional way where you do microboluses. I call it similar to the micro Botox technique. I use a dilute form of the neuromodulator. So I add 2 cc's of preserved saline to a vial of either Dysport or Botox, because you can't get that much saline inside the vial. Then I draw it up into a 10 cc syringe, and I add another 8 cc's of preserved saline. Then I use the Mesoram, and you get it at mesoram.com, and it's an apparatus that allows you to inject simultaneously 5 or 7 needles, but they're very shallow, 4 millimeters in depth. You cool the skin off, and then you do multiple injections in the area that you want to treat. And you do 5 cc's per side. Now there's going to be a little left in the Mesoram, and you flush that with another 2 cc's of saline, and you get all the Botox or Dysport out of the chamber. It takes around a minute per side and much less painful than the multiple injections. So now for hand and foot hyperhidrosis, now we're moving from here to the hands and feet. The traditional injections are done around every 10 millimeters, about every centimeter. I use Frozen C in the hand, as well as Artec, which is a cooling device, Zimmer Z-Wave, and ice. I've experimented with aqua gold treatment, which are those canister with the mini needles, and I didn't get that much improvement with that. So some of my colleagues took that and ran with it, and they're using it routinely. Okay, you just have to use probably more Botox or Dysport to get the same effect. So, but it's much less painful using the aqua gold on the hands than it is with the injections. So here's where I'm going to talk to you where I think the people should go with hyperhidrosis of the axilla. It's using RFM. I use the Genius, I used to use the Infinite. So the eccrine and apocrine glands, those are the glands that secrete sweat. They lay at the deep dermis or upper subcutaneous fat in the hypodermis. The RFM creates areas of coagulation that partially destroy these glands. Okay, I call it almost like a carpet bomb effect. So you're kind of you don't know exactly where those glands are, but you're just hitting them repeatedly at different levels, and you end up hitting most of them with this treatment. The glands don't grow back. They're different than the sebaceous glands, which do grow back, the ones that secrete sebum in acne. So these don't grow back. So the results are rather long-term or even permanent. I'm going to show you a paper that it wasn't. So when I'm doing RFM for axillary hyperhidrosis, I do a starch iodine test to document where the sweat is. Because I'm going to show you another picture where I didn't document it exactly and I only partially treated the sweat. So then I apply a topical anesthetic, and then I clean it off with sterile HIPAA. I use the Zimmer Z-Wave and Frozen C to improve comfort. The Frozen C has added a lot more comfort to this device. So the depths are 3.5, 3, 2.5, and I do 1 to 2 passes alternating sides with the RFM, the Genius. Very high energies are used, so I use 40 to 60 millijoules per pin when I'm doing this with the Genius. The treatment time is about 15 to 20 minutes. So now we'll get to the paper that I did with Dr. Chillicurry and Rob and Grossman, and that was in JDD in 2018. And our results were this. Anesthesia was either topical or the mesoram injections or with Pronox. Hyperhidrosis scores went from 3.2 to 1.6, so they went in half. Satisfaction scores were 8 out of 10. Results were apparent at day 1 through day 7. So the glands stopped secreting rather rapidly. You don't have to wait that long to see results. There was a long follow-up at 3 years that continues to show persistence of decreased sweat. Side effects were redness, bruising, and soreness, but it was very limited. So in my experience, most patients only required 2 treatments. Long-term results, and the sweat was manageable after that with just OTC medications. So they were like a 1. All my patients were a 1 hyperhidrosis score after treatment, at least 2 treatments. Actually, I never treated anyone with 3 treatments. It was 1 or 2 treatments. So this is another study. This was done in Korea in 2013 using RFM. So 2 treatments at 4-week intervals. The hyperhidrosis scores were 3.3. At 1 month, the scores went down to 1.5. At 2 months, they went slightly up to 1.8. But you know, though, as I showed you, those scores are kind of arbitrary, so someone could say they're a 2 or a 3 sometimes, and that could sway this a little bit. The biopsies showed that there was definitely gland destruction. And they also showed that sweat reduction was documented with some type of TWA meter that shows that the sweat was decreased. And there were no adverse side effects. So this is an interesting study because this kind of contradicts my study. 3 treatments at 3-week intervals. The hyperhidrosis score went from 3.4 basically to 2.5. But at 1 year, there was 46% had relapse. They said that the relapse was associated with a high BMI score. So that means they were heavier. So what I suspect is that there was thicker skin there and the needles didn't actually penetrate down to the glands quite as well. So they didn't get quite as good a result. The other thing that I did is I looked at the energy settings, and the energy settings were much lower than my protocol. So take it for what it is. They said there was relapse, but my protocols are much stronger than theirs. I also treat facial hyperhidrosis. Okay, I haven't written a paper about this, and this is what I have found. I've treated 4 patients with RF Microneedling for facial hydrosis. 2 to 3 treatments were needed. The patient reported 30 to 40% in improvement after 1, and then 60 to 65 improvements after 2 or 3. And the results were long-term. Okay, if they have underlying rosacea, you need to treat that with a vascular laser because sometimes that exacerbates the swelling. So I've been asked this several times, can I treat the hands and the feet with RF Microneedling? I think pain control is very difficult. Okay, swelling can be prolonged. There was a person that I heard did this in South America, and they had a week-long hands swelling. And unfortunately, they did both hands, so the person was incapacitated for over a week. I don't really know what the results were. The problem with the hands are the depths of the skin on the hand is highly variable. So you don't actually know how deep you need to go with the microneedles. So yeah, I can do ultrasound, but it's going to change because you have calluses and so forth throughout the hand. So it's very difficult and it's very painful. As I said, maybe ultrasound might be helpful in the future, but I haven't had that around long enough to try it. So what's the future? So I'm going to talk to you about some things that are kind of interesting for the future. So I told you that glycopyrrolate, which basically is an anticholinergic, is useful when taken orally. But what they did is they made it topical. And what they found is 53% had an HDSS score of 1 or 2 when they all started at greater than 3, and a greater than 50% reduction in the galvanic sweat score. Okay, great, okay? They improved. But the vehicle, the control, had 36% improvement. So 36% improvement versus 53% improvement. And that kind of shady. So this shows you exactly how it works. So the compound binds to the sweat gland, and the acetylcholine cannot be released when it's added. I think that this is actually very appealing. Okay, this isn't yet FDA approved. Okay, Candescent Biomedicals, CDX 101. So you have this patch that you put on under the arm, and when water is exposed to this patch, it heats up. The heating up is similar to the RF microneedling, but not to as much degree. It's an alkali metal, and the heat causes the sweat gland to shrink. So you put it on for about 3 minutes, and the effects start at 24 hours. As I told you, the glands shut off once they're injured. 69% improvement persists at 6 weeks with one treatment, and 89% still respond at 6 weeks. Side effects were minor, and they were treated with a steroid cream. So how does this work? So you have an alkali metal, and when you add water, it causes heat. And that heat is exactly in the area where the glands are in the axilla. Okay, and this is showing you that there's an adhesive background and the alkali metal. It's very easy to use bilayer pads. So maybe this is the future for people that want less invasive procedures. It's not gonna give you permanent results, but it gives you at least 6 weeks, and if you want to come in every 6 weeks to the doctor's office, well, maybe it's an option for you. So that concludes my little slideshow on hyperhidrosis. I talked to you about RF microneedling being my choice for treating axillary hyperhidrosis. It's quick, simple, and very effective. Mirror dry is also used for that. I don't have it. The problem with mirror dry is it's only a one-trick pony. It's really only good for axillary hyperhidrosis, whereas RF microneedling is great for a lot of different things. So thanks for watching. See you later.